is our maternity fair, and during this day we intend to celebrate life, celebrate these mothers and people who have gotten pregnant within this year and seeing their journeys. During the day we are going to see how we are going to have different events which include nutrition counseling, Lamaze classes, physiotherapy. We are also going to have a little bit of dancing because we need to dance, and also we are going to learn a lot.
Here we have a checkup of our pregnant mothers, where we do more of history taking. We want to see what aspect do they have in terms of the previous pregnancies. We want to see what is the gestation of that pregnancy. We want to do more of blood pressure so that we can see if there are some complications that are arising as a result of this pregnancy. We are looking at the danger signs in pregnancy to include history of bleeding, history of reduced fetal movement. We are looking at elevated blood pressure. We are looking at edema or swelling of the body as a result of this pregnancy.
This is our second maternity fair. We did the first one and it was very successful. Why did we talk about a maternity fair? Maternity fair, we thought would be interesting, taking us as mother and child. We are talking about that mother and that child who hasn't been born. We thought if we brought them together and have a fun day when they are not sick, when they come here and they ask questions freely, when we interact with them at a very loose kind of time, we are not charging them anything. It brought us even new faces. Some of the people who are our neighbors came to see what is this fair all about, and we got even more patients coming to us. And we also understood what makes them decide we are here and they are going to a clinic in Kayole and they are leaving us here. So they give us feedback about us. What do we do? How do we do it? And what it is we can do to make them come more. And we thought it was a good thing the last time we had it. So we decided to have another one.
Mukopoa! Aya, weka mziki tukatike kidogo. Weka mziki, watu wanalala sana bana. Watoto wanaanza kulala kwa tumbo. Hebu tuanze.
We are also having specialist maternity nurses or midwives who are going to examine our mothers, and after examination we are going to give guidance, specialized guidance, and we also have our obstetric clinics that are open for free. We are also doing other tests, including lab tests and obstetric scans to see how the babies are doing with the mothers.
Kama mama unaambiwa wakati unapotoka nyumbani hakikisha kwamba umetembea angalau na chupa ya maji.
I'm a nutritionist. I'm licensed by the Kenya Nutritionists and Dietitians Institute. Initially, I've worked under Kenyatta National Hospital, where I've been attached for clinical practice. And today, I feel the pleasure to be with the Mother and Child Hospital for the nutrition care services.
Caffeinated drinks. Caffeinated drinks zinapatikana kwa vitu kama majani. Sawa sawa. Instead ya kutumia majani, unaweza tumia drinking chocolate. Sawa sawa. Ama unaweza tumia soya.
I've found it a very interactive session whereby I've gotten to learn from my fellow medical professionals on some of the things that can affect the pregnancy, and also it can lead to complications that can affect the delivery process. And therefore I found it a very interactive session that personally I also feel that I gained something apart from delivering to the group that is the pregnant mothers.
Now we are going to the next part penye tunaenda kufanya exercises zenye zinafanyika na wamama wakati wakiwa wajawazito. Sawa sawa. So naita daktari wetu.
Habari ya kina mama. Habari zenu upande huu. Habari zenu tena. That is better. Sawa sawa. Kwa majina naitwa Cynthia. Mimi ni daktari wa mazoezi.
I am a licensed physiotherapist who has been practicing in Nairobi, Kenya, and some parts of Kiambu County for the past around 8 years now. And I have been invited to Mother and Child Clinic to educate pregnant mothers on how to take care of their bodies during pregnancy, how to do their daily activities during pregnancy, and what happens after pregnancy.
Si tumelala hivyo. Kwa hivyo wakati tunaamka, hakuna kuamka ukiwa straight. Sawa sawa. Ukiamka ukiwa straight, hiyo inaweka pressure mingi sana kwa tumbo. Sawa sawa. Na tukumbuke hiyo misuli ya tumbo imevutika sana. Si ni kweli? Kwa hivyo tukiweka uzito mingi sana, inaweza leta matatizo after kupata mtoto. Sawa sawa?
Education is important for pregnant women to know, postnatal women to know, and also for prenatal women, so that they can avoid certain complications and discomfort that happens during the pregnancy and after the pregnancy. Because most of the things that happen after pregnancy or during the pregnancy happen because of lack of information.
Unarudisha makalio nyuma. Hiyo inahakikisha ya kwamba unatumia miguu. Sawa sawa. Uzito yako haiendi kwa mgongo. Alright? Kwa hivyo kama ni kuchukua mtoto, so unainama, unamchukua.
What the women needed to know is, number one, how to do their daily activities safely. For example, how to pick up their child if they have a child and they're already pregnant. The proper technique on how to do that without putting so much pressure on your back. Something else is to how to engage or how to prevent back pain issues after, by making sure they do not do heavy work. Something else I have been able to teach them is how to start training your pelvic floor and abdominal muscles as early as prenatal, during pregnancy, so that after delivery your muscles are not strained, because pelvic floor weakness and abdominal muscle weakness is a common problem that happens after pregnancy. So to prevent that from happening, we have to start the preparation process as early as now. Something else is during the progression of labor, how to do controlled breathing and what they are required to do during the labor to help ease their process during the laboring process.
Kwa hivyo usiconcentrate on the labor. Unahakikisha ya kwamba una breathe in. Sawa sawa. Unaingiza hewa na mapua, unatoa nje.
So it is a very good opportunity to be able to reach this crowd today at Mother and Child Clinic. And I am sure that the information they have learned today, they will pass it on to a friend who will pass it on to a friend, and they will be able to understand the importance of a physical therapist in pregnancy and women health in general.
Habari zenyu. So naitwa Masi, niko hapa on behalf of Hanan Products. We've been invited by Mother Child Hospital to be part of this fair event 2024, and we are going to educate mothers on different types of wet wipes. Kama hii hapa inaitwa Hanan Sensitive Wipe. Hii inatumika for extra sensitive babies, na wipes za Hanan zina alcohol, so hakuna vile ita affect mtoto wako ama itaku affect. It's best for you and best for the baby.
Haya, mwenye anakuja kudansa mimi anajishindia Hanan sai. Haya, Hanan ndio hiyo inaanguka.
Three, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
Makofi! Acha tuone uko kwenyu.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1.
Unachuana?
Wajaenda mbio kama watu wangu. Watu wangu wameenda mbio.
Show kwanza form ya Didon nishashika mpua na twende chini kwa chini akiwa adi na mini. Sasa tunasikiza Shin City, tuna feel free. Teka video na post pale NGC. Jina ni Kantel Kurapsi ni talent G. Anguka na check.
Leo ni siku yenu. Just come. Na sitaki asante mama mwingine. Kata. It's a red velvet. Hapa mnaona tunapendanga colors. Inaitwa red velvet.
We love you, mothers. Go purchase Hanan wet wipes or Bella wet wipes. You have the best quality of wet wipes.
I am glad that you have attended this maternity fair. For sure, this is the rightful thing to do, because we are an advocate of safe pregnancy to term, and we are an advocate of both mother and baby's health status. So welcome and feel much appreciated for Mother and Child.
Welcome to Mother and Child Hospital. Our hospital is not just for mothers and children.
I'd like to invite any person who would want to come and use our services to come to Mother and Child, and I tell them, try us. Even if you have never been to Mother and Child, try us.